Good afternoon, everyone. This is Hiju Park, the owner and pharmacist from Key Compounding Pharmacy. And then let's welcome Dr. Nina Walsh this bright and sunny and beautiful day on Monday.
Today.
It's gorgeous today. How pretty. And I think we're getting into the real like a spring, right? We had some beginning of spring. Now we are gonna center of spring, and then everything is rejuvenating, and
everything, yes, everything is out.
Yes,
in the very heart of blooming. All the flowers are out, all the leaves are out. Just in one almost overnight, things exploded, and
yes.
we have all these colors and bright green leaves everywhere.
Right.
So
yeah.
It's amazing. There's no denying.
Yes, all the cherry flowers, now they're on the ground, and we had a lot of beautiful scene on the ground, the pink and red and white and all that. So
almost like a painting on the ground.
Yes, exactly.
Yeah.
Last few weeks we were really visiting our body, especially the liver, because that's the organ for springtime.
Mm-hmm.
And so we went over the function of it. We went over some food and herbs and about how it works, and we touched on some other things, but emotions and whatnot. But today we'd like to go a little bit deeper into a little bit more specific.
Mm-hmm.
So Dr. Walsh has like to talk about PCOS today with the female, and how that's all related with our liver and then our insulin resistance and lifestyles and our emotions and all of that.
Right. So we'll continue to talk about liver as the organ that is the most active organ in the springtime. So spring is the time of liver activity, and green is the color of liver in Asian medicine. So, and more specifically, so we talked about how to cleanse the liver, but today, yes, and I know that PCOS is an issue, that unfortunately plagues women, young women in today's modern society. Those women, especially who are interested in pregnancy, because it can unfortunately interfere with fertility, healthy pregnancy. So, and liver is very much central to healthy ovarian function, to healthy menstrual cycle, to fertility as well,
Right.
Although it's not the only organ, but specifically in PCOS, liver seems to be the central organ. So
when we
PCOS,
normally think about that, fertility, we don't typically think about liver.
yes,
right?
we think more about kidney, actually.
Right.
That's kind of in general the hormonal system, fertility that is intrinsic, right? But the functioning fertility, and in this particular case, dysfunction in it, right? So that is related to the liver health or, liver imbalance in this case. And so PCOS stands for Polycystic Ovarian Syndrome. Syndrome usually means that there is a number of different sort of components, and it can vary from person to person. And so a very important component is dysregulation of menstrual cycle, specifically ovulation. It could be problems with ovulation, could be even absent ovulation. Sometimes even it could be absence of bleed itself, absence of menstruation itself. So that does tell us that there is a disruption in proper hormonal function.
Right.
And liver is very much involved in balancing hormones in the body in general, and specifically steroid hormones, right? Sex hormones, and in this case, androgens. So another feature of PCOS is elevated androgens, or testosterone, DHEAS. And another hormone that is typically elevated is LH, luteinizing hormone. And there can be relative deficiency of progesterone and follicular stimulating hormone, and sometimes elevated estrogen, sometimes actually not. And cortisol is also involved. We see oftentimes elevated cortisol. So if we looked at the blood work, so we could actually tell that there is, this PCOS picture.
Which is really the, indication of stress.
Well, stress is a very big part of the the whole sort of dysfunction. And then one other important component clinically of diagnosing PCOS is presence of ovarian cysts. Could be one side, but for the stronger diagnosis, it's bilateral. And obviously, they're not, even though they're benign, but they're a problem, right? So they can create a problem with the period. So it may be profuse bleeding, could be darker blood, could be clots, could be very painful periods. But that also, interferes with fertility as well. And so, in terms of the actual experience of the woman, how that can manifest, how PCOS usually manifests, is very often is excess weight. Sometimes obesity, sometimes really, really difficult time trying to lose weight. Oftentimes acne, of course, hormonally related acne, something that becomes worse around the period, before or right during the period, and that's usually, kind of concentrated on the lower part of the body, but not just of the face, but not just on the face, could be also back. Then a very, very big key kind of problem in PCOS is something that you mentioned, is insulin resistance, right? That is really, really key issue that we always need to address, something that continues to contribute to hormonal dysregulation and infertility in PCOS.
That's why, as a pharmacist, we see commonly the metformin has been prescribed,
which is the standard treatment for PCOS, and that is done to to improve insulin sensitivity. So, of course, it doesn't do anything for regulating the cycle, but per se. But still, that is what is done in standard medicine, and it can be effective for that, right? Because it's the number one treatment for diabetes, and usually it's a lower dose. They start with lower dose. What else? It's PCOS presents risk for cardiovascular system as well. It can be cause of elevated blood pressure and all the risks down the road in the cardiovascular system. So even though it is not such a disease that is treated pharmaceutically, other than when women are trying to conceive, it has really kind of long standing ramifications. And so in Chinese medicine or in Asian medicine, it does signify liver imbalance. It correlates very much with liver imbalance, because that disrupted flow that I described, and then finally accumulation of blood into actual solid mass, that is an effect of liver not being able to do its job, which is conduct the energy, proper flow of energy and blood. And when liver is clean, and when it is able to detoxify and cleanse the whole body, then that flow is harmonious, And so that's what we need to do, to harmonize the liver so that that flow of blood and fluids in the body can be harmonious, and there is no accumulation, there is no actual, cyst form. So, so we go between Asian and Western medicine because I think they really complement each other so wonderfully, and that gives us this kind of a full view, of the picture, completely holistic understanding of the picture. And I love that we are able to bring pretty much, any kind of medicines into the case to help our patients.
Sure. So, while I'm hearing you, in my mind, I was kind of picturing that when you say about the flow, that when the liver functions well, it really helps the flow of blood, the flow of energy, so that things doesn't stagnate, things flow.
Correct.
So like if cyst is form of the stasis
of blood,
right? So I was imagining in my mind, it's the same with our mind. When our mind flows and kind of natural versus someone is kind of stuck on some ideas or some emotions and cannot get away, and that emotion becomes like a cyst.
Liver, and liver, the stagnant emotion as well. So liver is very susceptible to stress. Liver is very much affected by those stagnant emotions, especially anger, as we said last time, right? But anger can really be expressed in many ways.
Inflammation, right?
Well, yes, and
we talked about.
Right.
That's how the it starts little inflammation.
And there is actually inflammation in the ovaries, and we do include anti-inflammatory treatments for that, when we address PCOS. And so given all this, right, so we have several strategies that we can include that would be very effective working together.
Right. Where do you even begin, right, as a
clinician? Of course, we focus on the liver and our quintessential liver herbs. Some of them we mentioned last time. So milk thistle, Schisandra berry, which I love. Yes. We have rhodiola, which is an adaptogenic herb, but is also helpful for the liver. And then Ganoderma, or reishi mushroom, which is called the mushroom of immortality in Chinese medicine. So it's a wonderful liver detoxifier, liver restorative herb. And these herbs also help decrease levels of cortisol. Cortisol promotes insulin resistance. So it's not just, the sugar, right? The sugar in the blood, but also stress also promotes insulin resistance. And there's a very, very direct link. And so these herbs, they work both on the liver, but they also help decrease the stress response in the body, decrease lower cortisol, and therefore, stabilize that insulin response. So in Chinese medicine, we mentioned last time, anything that is fragrant, aromatic herbal teas will help harmonize the flow and, decongest the liver, harmonize the liver really. And so spearmint has been shown to be effective in increasing sex hormone binding globulin, and that will decrease testosterone, right? It will bind free-floating testosterone, it will bind DHES, and will lower that impact of androgens, we call them. Same thing will do green tea. And of course, both of these are wonderful anti-inflammatory and anti-aging. They're full of antioxidants. Green tea is cancer protective. So, there's always many wonderful benefits that we, enjoy as side effects from these natural treatments, right?
Yes.
So, to help balance progesterone, to help improve progesterone levels, we can take Vitex. We can use Vitex. And so usually, as I already mentioned before, I create a tincture, an herbal tincture formula that combines all these herbs in the proper ratios. So we're addressing decreasing testosterone, decreasing cortisol, improving the liver function, probably elevating progesterone a little bit. We can also bring something in to actually quench the sugar, like something like gymnema, for instance, which is directly helping pancreas to, get the sugar out of the blood and into the cells and lower the blood glucose levels. We use that in treatment of diabetes. So that is a very effective and very important strategy. And then also addressing stress response. In addition to these herbs, I always recommend movement. So movement obviously is helpful not only for excess weight, right? But it's also helpful for strong metabolism. And in this case, anything that, we can move the liver energy in many different ways by physical movement. And it could be just, gentle walking, but definitely walking every day. I recommend 7 days a week, at least 30 minutes a day. But if you can do an hour, it's better. And if you can do walking meditation, just listening to music or really enjoying the view if you're walking in the forest. Yes, in nature along a beautiful bay. Yes, so like we have so many beautiful sites here, and just being, in that moment and breathing. So all of that will harmonize the liver. All of it will help reduce stress and help liver become less angry, less stuck, and release those stuck emotions, as you mentioned. So
how about any recommendation on the diet?
Yes, well, this actually is the first thing, the first approach that we utilize. And studies have shown that the Mediterranean type diet is very effective in PCOS. So what does that mean? We eliminate processed foods. We emphasize plant-based foods, and it's really vegetables. And of course, we love cruciferous, right? We love cabbage family vegetables in all different forms.
Bok choy, radish, and all
Bok choy, radish, arugula, kale, cabbages, and all that. because they contain, or they help our body make glutathione, which is the number one antioxidant, and the liver needs it for pretty much every step of detoxification. Glutathione is what pushes detoxification pathways in the liver, but also all the other cells in the body. It's just liver does the most work in terms of detoxification for the body. So I also specifically recommend excluding not only sugar to help with insulin response and sugar balancing mechanism, but also grains, and that includes actually whole grains. Some physicians are okay with small amounts of whole grains, but regardless, the understanding is that grains promote insulin resistance, promote conversion of glucose to fat, and that fat begins to form around the belly, around the waist, and that becomes metabolically active fat, and that contributes again to high androgens.
Right.
So that disturbs the proper hormone balance. So I recommend just really staying away from grains. And
how about some animal food? Do you also?
We do eliminate dairy. I do recommend getting away from dairy when we are dealing with something. And if the goal of the couple, of the woman, is to get pregnant, we might as well really have a complete, thorough, comprehensive protocol that really will help. Not just 30%, not just 50%, because like I usually say, if you don't get the water to the boiling degree, it will never boil, right? I mean, it will kind of get there, but not all, so you might as well be serious about it. But that doesn't mean more stress. So as much as possible, I still recommend, when we work with PCOS, we start with a 6 months kind of horizon. That doesn't mean that 6 months is a guarantee that there will be a pregnancy at the end, but for 6 months, what I recommend that a woman or the couple do is just kind of focus on being healthy. Focus on becoming really as healthy as you can be for the sake of you, of your own body, your own being.
Who they are, right?
Yes.
Accept themselves.
Right, and just really, really bring yourself to the optimal level of health for the rest of your life, right? But also for the sake of the vitality that you are transferring to the child, and for the sake of pregnancy. So, and for 6 months, don't even worry about anything. And very often, actually, when we start doing everything and we include all the treatments, people come back in a few months and they'll say, well, guess what? and of course, I always use acupuncture, because in acupuncture, they have seen in studies the much higher rate of pregnancies compared to control group where women were not getting acupuncture. So, that's what I mean by comprehensive strategy. But diet is an absolute cornerstone of that. And so, in that diet, Mediterranean type diet, will help you get healthy in general, no matter what, right? And then, as much as possible, just trying to not make the pregnancy the goal at the moment, right? It's not like you're living to get pregnant, and that all your life is focused around that. No, just taking a big breath and releasing, and just taking it easy and focusing on really doing what makes you happy, what makes you feel peaceful and relaxed. Because when your body is
uptight,
and really, it doesn't want to hang on to another, job to to deal with, right? Another load to take care of. But when it is at its healthiest and it is relaxed, then it is free and it is really supported in all possible ways to do what it naturally wants to do. And so that's how we bring it to that natural, healthy, beautiful pregnancy. So I want to mention that we do use hormones, and of course, again, standard treatment is to use maybe Clomid to support cycles, letrozole, things like that. However, the side effects of Clomid will be thinning of endometrial lining, and that is important healthy, nice, thick endometrial lining is important
to support
for
the growth.
implantation, right? Because if we have the fertilized egg, if we have a healthy follicle which we want to grow, and if we have this fortunate event of the sperm, good healthy sperm meeting good healthy egg, and then the egg becoming fertilized egg, then we want to have a healthy home for it to be implanted and to be able to grow. And so for that, we sometimes supplement with bioidentical progesterone again to support that luteal part of the cycle.
Right. Yeah. And also perhaps someone with really imbalanced hormones, you probably want to use other type of also hormones, to balance it out too.
Sometimes we do, yes. Sometimes we do. And so we'll look at the whole picture.
Right.
Definitely.
Yes. When you do that, you will use more natural hormone replacement?
Yes, I use bioidentical hormones, and of course compounding pharmacy is a big partner in that. And so bioidentical hormones actually also provide anti-cancer protection, protection against cancer versus cancer risk in some in cases of synthetic hormones and xenoestrogens, of course.
Yes,
so all of these things are very important in overall longevity and health and vitality of the woman and her family, people around her.
Yes. So if I summarize what I heard is that in terms of how to go about helping yourself, if you're concerned about this, is of course finding the good clinician that really fits with you would be the first step. But overall, picture-wise, the diet is critical. Around your liver and your insulin resistance.
Yes, restoring normal insulin function and regulating blood sugar mechanism, normalizing weight, normalizing body mass index, decreasing fat tissue, improving lean muscle tissue, stress management.
Right. Before you even get into diet, it's start with your mind. Be more relaxed.
It really is key, yes.
Right,
and just let your body do what it wants to do and support it in the best way. Flood it with nutrients. Help it come to a balanced, state. And then it will naturally want to receive,
Right.
And another thing that I wanted to mention, we do use supplements, but supplements are, again, as I always say, supplemental to the fundamental healthy lifestyle and diet. And some of those supplements will be, again, those that help cleanse the liver, so N-acetylcysteine or N-acetylglutathione, right, to promote detoxification pathways in the liver. Then SAMe, acetylmethionine, which is quite expensive, tends to be more expensive, but then we can use methionine, just regular methionine, and that is a methylation donor, methyl donor, so methylation factor, but it also helps clear estrogens from the liver, so it helps liver and hormone metabolism. And then vitamin D3, very simple one, very important. And I also use diindolylmethane for proper, again, estrogen metabolism.
Yeah. Okay. So there are many the helps out there.
Yes.
But I think it also, again, it starts from ourselves, our mind, and then incorporating your diet, your supplements, or your other acupuncture or the BHRT,
including all the tools. Yes.
Right.
And it may sound overwhelming, but it always makes sense when we work with with patients, and it does become just natural lifestyle. It becomes a habit, it becomes a natural, easy flow. So it's really not difficult to maintain, and you see many health benefits besides your improved fertility.
Right. So that's why I think it's critical to have or meet your right clinician for you, so that you feel like you can have the journey together. Right. And then the clinician is like yourself, is the educator, the teacher, so that it shares in such a way the patient doesn't get overwhelmed, but feels like it's a natural thing to do, right?
Right, and so that we can help you sort out the picture of hormones. What does that number mean? How can we deal with that? Is there, a way to solve it? And which supplement, is it myo-inositol or inositol? How much, and so on. So.
Yeah. So I think that's very critical. So in that sense, if it's any of our listeners are, they want to contact you to see whether they're right fit, then how do we contact you?
Well, of course, I practice here in Federal Way and in Bellevue, Washington. So I, split my week between my two locations. And the listeners are welcome to contact me at 206-384-2414 or send me an email to ninawalshnd@yahoo.com. So you can also find me on my Facebook page and so online.
All right, great. And so I love our discussion, and also you sharing some of your clinical experience. I was really intrigued by utilizing like acupuncture and things like that, and combining with our Western wisdom that we accumulated, and really help the things get flow.
Yes, exactly. That's our purpose. Healthy flow.
Yes. Okay. Yes. Great. And so it was another great podcasting today, and then I'm looking forward to have Dr. Nina Walsh in a few weeks again. Thank you.
Thank you so much. Thank you for having me.
Yes.